good afternoon. This is Wednesday, November the 18th, and here we are almost at the end of the year on the Health,
Yes.
Wellness, and Lifestyle Program with Linda Dorman and Dr. Donna Christensen. And we are here with two amazing guests. I'm going to let Donna make that introduction, but hopefully
Yeah.
you'll be able to tune in.
I'll try to make it brief because we have a lot to talk about. And let me introduce Dr. Gardner, who is, as it says under the headlines, a public health activist, administrator, evaluator, and researcher. He's worked for over 25 years on studies ranging from hypertension to AIDS to breast cancer, diabetes, and smoking. But for the past 20 of those years, he's lectured around the country on African American health disparities and smoking and menthol in particular. So he's currently the co-chair of the African American Tobacco Control Leadership Council. The other co-chair is Carol Magruder. She's a seasoned veteran of California's tobacco prevention experience. She's worked in the tobacco prevention area since 1994. She's experienced in the fields of public policy, social marketing, media advocacy, and global tobacco control. And as I said, she's the founding member and co-chair of the African American Tobacco Control Leadership Council. So maybe we could start with, what is the African American Tobacco Control Leadership Council?
Good start.
Well, first, thank you for having me.
I'll take that on.
Oh, good. No, go ahead, Carol.
Welcome. And yes, Carol, can you just give us a little bit of the back history
Yes.
of the organization and how it was founded and what it espouses to support and do?
Certainly. So yes. And so we want to thank you very much for having us on today, me and Dr. Phil. Our council was founded in 2008, mainly as a pushback to some of the cuts we were experiencing in the state of California with regards to priority population and African American leadership in the tobacco control space. Because if we don't have public dollars, there are no dollars for what we're doing, at least at that time. And the year after that, in 2009, was when President Barack Obama signed the Tobacco Control Act that Dr. Christensen had a little something to do with, and at that time off the market. And that thrust us into the vacuum of leadership on this issue nationally to get mentholated tobacco products off of the market. Our mission is to save the 45,000 Black people who die every year in this country from tobacco-induced diseases. And that's 45,000 mothers, fathers, grandparents, the anchors of our communities, of our family, who die every year, and the impact of intergenerational harm that has. And our other main thing that we're doing is to really push back against the vicious and predatory and racist targeting that our community has been experiencing at the hands of the tobacco industry for decades.
This is such an important subject to me personally because of that 45,000 that you mentioned. That affected my family. My mother, a chain smoker, lifelong smoker, when back in the late 50s, early 60s, smoking was on television. It was very cool. It was very sexy. It was very acceptable. And unfortunately passed from cancer as a result, lung cancer and also oral cancer. And so it brings me to this conversation with, an open understanding of how do we as citizens support this movement?
I think, so again, let me just thank you for having us. I think actually I want to go back to what Carol said. The original sin of the federal government in 2009 is when they got rid of 13 flavors in cigarettes and only left one on the market. That one was menthol cigarettes, and menthol is disproportionately used by Black folks. And Black folks die disproportionately for tobacco-related diseases. So we are about saving Black lives. How people can get involved, and be very frank with you, the FDA is considering now putting forward a rule that would remove menthol as a characterizing flavor in cigarettes. Please write the FDA and ask them to do that. But let's be clear, even if the FDA does that, the tobacco industry is going to block it, going to sue, going to go out of their way. So we would encourage people to work with their local city councils, with their county board of supervisors, with their state assemblies to actually get menthol and flavored products off the market. There's no need to put candy flavor into poison. Okay, there's no need to do that, and so that's what people can do is actually make the FDA get rid of it, but be aware that the tobacco industry is going to block it. So please join the fight on the local, the state, and the federal level.
And back in 2009, Linda, they fought valiantly and hard and long to try to get menthol removed, including working with the former Secretary of Health and Human Services, Louis Sullivan, who had gathered about all of the other living Surgeon Generals or Secretaries of Health and Human Services to fight to get menthol out. So we couldn't do it then because of the pushback, not only from the cigarette companies, but also from some people in the Black community. And can you talk a little bit about how we were targeted?
Yes.
Let me give you
African American from the African American point of view.
Yeah, let me kind of start it, and Carol, you can finish it. Let's look at it this way. In the 1950s, only about 5% of African Americans smoked menthol cigarettes. We actually have data on this. By 1968, that had almost tripled to 14%. By 1976, that had tripled again to 42%. By the mid-2000s, it had gone over 80%, to where today 85% of Black folks who smoke menthol cigarettes. So it gets back to your question, Donna, where did this come from? It came from them pushing it down our throat, making it cheaper to buy, making more promotions, using athletes that we knew, using songs, the Newport Jazz Festival, the Cool Jazz Festival. They've even turned it into hip hop now. They've used our culture. They've used our performers. You asked the right question. It's the targeting. It's the targeted marketing of this poison that has led to African Americans dying disproportionately. Carol?
And how has the Black community responded? They've been,
Yeah,
I mean,
and
there's been those that support this effort and there are those that don't.
So I'd like to add in that when we, and Dr. Dorman, with you're talking about your mother, when
Go ahead.
I think she's frozen a little.
Oh.
Yeah, this brings to mind when you talk about those sponsorships, and you mentioned not only the advertising, but how those brands were associated with our culture. And these were the only brands that understood that if we support the Black community in what mattered to them, they would turn around and be loyal to our products, to their products. And I think, and making it okay. Now we couple that with the disparities in how healthcare and treatment of healthcare and how we show up in clinical trials or don't. We don't make that connection that we didn't understand that this was killing us from day number one. And now here we are fighting.
Carol, are you back with us? We had lost you for a minute.
Yeah, I'm still here. Can you hear me?
We can hear you now.
Okay.
Yeah, there's a little lag. So, anyway, go ahead, Carol.
Yeah, there's a choppiness. So with that, I was going to say that with the targeting, that many of us now, and especially people probably listen to this program, we're educated, we've arrived at a certain level, and we think, well, I don't smoke, and that it's an individual choice. And that's how it's positioned, that if people can do what they want, that we're free, we're adults. But we need to understand the media, the paying off of our media, this targeting that was so pernicious and comprehensive that what we think of as a free choice actually was not. It was very much a choice that was influenced on multiple fronts. And that when you talk to folks today, they'll say, well, I don't smoke, not thinking about your parents, your cousins, all of these 45,000 people who are dying every year. They're related to somebody. They're someone's parent, they're someone's child, they're someone's sister, brother. And that's what, so even though the individual might say that this has nothing to do with me, it has everything to do with our community. And the money that leaves every year and what we purchase with that money is death and disease for our community.
And let's not forget the reality that if you're in a home or a household or around a consistent smoker, there is a such thing as secondhand smoke. And I know that it's been very devastating to my personal family, and I know many others. And so it is absolutely something that we must address. And I'm kind of curious to understand, in 2 states, you mentioned California and Massachusetts have in fact banned menthol cigarette smoking. What did they do differently that other states have yet to understand to do?
Well, they don't have Carol and Dr. Phil out.
They don't have.
I mean, that's nice, Donna. I think what's true is that there are public health officials and public health activists on the ground in the poor Black communities that actually have made an argument for getting this out of our community. So what we've tried to do, the AATCLC, is we traveled around the country meeting with different people in different locales and encouraging them to do that. Keep in mind that as we're speaking, over 100 local municipalities have adopted not selling menthol products, over 100. And there's state movements taking place as we speak right now in Maine and New York. Be aware that New York had a bill before it earlier this year to stop the sale of menthol products. So this isn't just something. Oregon had a bill last year to do this. So this is ongoing. But let me just reemphasize this point. The further up the food chain you go, and this gets to Donna's point, the further up the food chain you go, the much more difficult it is to get change, because the tobacco industry has so much influence the higher up you go. But if we could work at the city council level and talk to people on the ground, we find that cities will take this up and prevent the selling of these products. So I want to encourage people who are listening to this to join us on the fight. There's a fight going on in Atlanta now. There's a fight going on in Detroit now. As I mentioned, there's a fight in Oregon going on now. The fight is reemerging in Denver now around getting menthol cigarettes. And at some point, I'd like to explain why menthol. Mm-hmm. What is it about menthol? Let me, if I could take, is that okay?
And I think that's important, because one of the reasons that we had so much trouble is we didn't have specific proof of what menthol was doing.
Exactly.
Through the cigarettes. We have that through the work of the council and others. We have some of that now. So I think it's important for people to understand why menthol.
No, I and thank you for doing that. People should be aware that menthol is an anesthetic by definition. It has a cooling and numbing effect. Not only does it mask the harsh taste of tobacco, it actually allows for deeper inhalation. The deeper you inhale, the more nicotine and toxins you take in. The more nicotine and toxins you take in, the more addicted you become. The more addicted you become, the harder it is to quit. Yeah. This is why they put it in there. Look, menthol, when it's added to cigarettes, when the body metabolizes nicotine, it becomes cotinine in the liver. But if there's menthol in that product, it slows down the metabolism, meaning it stays in your body longer. Mm. Menthol also penetrates cells' walls much more effectively. So if you have menthol in the smoke of a cigarette, it will allow the smoke to penetrate a cell wall much more effectively than if there isn't menthol in it. Okay. To add insult to injury, the tobacco industry knows that melanin, the thing that gives color to our skin, holds or contains, the darker your skin, the more nicotine is stored in your body.
My goodness.
When you add all these things, I haven't even gone over them. Let me do one other before I go on. If you smoke menthol, it generates more what we call in the brain more nicotine receptors, meaning the brain is then asking for more and more and more compared to cigarettes that don't have menthol in them. So when you add all this stuff up, it's a setup. And they're selling it to you. They're selling it cheaper to you. We have data on all this. This is why black folks die disproportionately. This is outrageous. The tobacco industry knew this in the first. How did I? How did I learn this? Is reading the tobacco industry stuff. Our colleague Dr. Valerie Yerger did a great book on smoking with the enemy. And this is Donna's point. There are many groups in the black community that are taking money from the tobacco industry that are essentially supporting the efforts of the tobacco industry. We have quite a fight in
A lot
front
of
of
us in the CBC were supported by tobacco industry.
I hate to say it, but I hate to say it, but you're right. The Congressional Black Caucus Foundation, specifically the CBCF, takes money from the tobacco industry.
And I wonder if that is because of a true sense of ignorance without knowing the numbers, really looking at just the dollar and kind of getting bought into what the industry is saying are these false narratives about menthol and its impact. But here's some statistic that I think is important as we've talked about the 45,000. It says researchers estimate that prohibiting menthol cigarettes will save up to 654,000 within the next 40 years, including the lives of over almost 255,000 Black Americans. Okay, the Black Americans represent over 1/3 of the lives that would be saved, 1/3 of the lives that would be saved. And I just think to myself, both of my parents were smokers, both had cancers, and these tobacco related diseases are prevalent: lung cancer, heart disease, stroke, coupled with other comorbidities, diabetes, obesity, high blood pressure. And the fact that you just enlightened us to this amazing piece of clinical information that our melon skin actually retains that poison much longer than someone who is non-melanated or lighter in it.
Or lighter. Yeah, no, it's
staggering to understand.
Yeah, Carol, I wanted to. There is some pushback that is enlisting African American lobbyists and so forth, saying that it's going to hurt Black people more. It's an attack against African Americans. Can you speak to that a bit, Carol?
Yes, certainly. So what's happening is that the tobacco industry, they have flipped their racist and pernicious targeting of our people, and they're flipping that and saying that the remedy, which would be to take these products out of our community, would be racist. And not only is it racist because that's what Black people, quote unquote, like, but it would be racist because it would involve more officer interactions, police interactions with African Americans. That we would have smuggling in a black market, and you would have cases like the enforced case of Eric Gardner in New York, who was allegedly selling single cigarettes because the tobacco tax was so high in New York City that it became profitable for people to just sell them, as we call loosey, one by one on the street. And so, our pushback against that is that it's the racist targeting of the tobacco industry that gets us in the position that we're in today, and that we need to do both things at the same time. It's obvious in our country that we need police reform, and there have been some meaningful steps towards that. But with George Floyd, with all of these things that we're seeing live on social media of Black people being killed, the industry has latched on to that, and our visceral pain at these instances and these events that have happened to our people. But the solution to police reform is not leaving the biggest racketeer, the biggest gangster, the biggest corrupt organization, which is the tobacco industry. The solution to police brutality is not to leave these products on the market. That we need both things. We need these products off the market, and we need police reform. And that this is not something magic that's just going to happen overnight. it is a process. When you say how long we've been working on this, we've been working on this a long time. And Dr. Christensen, when you set up the amendment to the Tobacco Control Act in 2009, you never dreamed here we would be in 2023. So we need to hunker down. We need to know that this is we're in the fight of our lives, really, to make these rule a law and to really take the steps that we need to disengorge the tobacco industry from our community. And that takes a lot of effort and will, but it takes people, first of all, understanding the complexity of this and willing to dig in and to fight so that we can save our people from this predatory activity, which kills far more than everything else. So homicides is 8,000 in this country, and that's everybody, not just Blacks. And then 45,000 Black people who are dying. So those numbers, when you compare them, they're both important and they both deserve equal attention and they don't deserve to be lumped together, that one thing has something to do with the other.
Thank you for that. I understand that back in April of this year would have been the 1-year mark that the FDA took a look at some rules prohibiting menthol cigarettes and flavored cigars, because we got to talk about cigars in this because it's tobacco-based products, and wanted to know what's the status of that proposed ruling that would prohibit menthol and cigarettes, menthol-based cigarettes.
Well, where we are, and unfortunately, the short story is the FDA is dragging their feet. Mm-hmm. I will go back and do some of the history, but just to answer your question directly, they put on their own calendar that after they announced the rule in April, that they would finalize it in August of this year. And of course, August has come and gone. Here we are in October. They haven't finalized it. Where things are, I guess, the hopeful story is that once the FDA finishes their rule, they send it to the Office on Management and Budget for a final review, or send it, as they say, send it to the White House. Once the White House has finished its review, then it's sent back to the FDA, which then will promulgate the rule. Now we hear that they say they're going to do it by the end of the year. We're going to wait and see. You should be aware that the African American Tobacco Control Leadership Council was one of the lead plaintiffs in suing the FDA in 2020, which actually led to them doing something, because we had been working tirelessly for a decade on the question of menthol, and they hadn't done anything around it. So that's where we are in terms of that. But be appraised that every time that menthol has come up before the FDA, whether in 2009 they got an exemption, in 2016 the FDA what we call deemed all tobacco products under its rubric. In 2009 it was only cigarettes. In 2016 all tobacco products, little cigars, hookah, e-cigarettes, all of that came under there. The OMB at that time, when the new rule went to them, redlined 16 pages on flavors and menthol, and said that no, you can deem all this stuff, but you have to keep flavors in it. So even though we're here at an auspicious time, and hopefully the FDA will do something, we still have to wait and see what the Office on Management and Budget is going to do, because history doesn't bode well. And the fight continues. I'm sorry, Linda, go on.
No. I want to make sure that we can, we're going to take a quick commercial break and then come back and pick up the conversation about what we can do as it relates to the FDA, because clearly you've done some things and we've moved on. So we're going to take a quick commercial break. This is the Health, Wellness, and Lifestyle with Linda Dorman and Dr. Donna Christensen. We'll be right back.
I'm glad I'm back.
ICABA, ICABA, stands for the International Career and Business Alliance. And basically, it's really about building, activating relationships that grow wealth.
What is ACABA doing? ACABA is putting you in an environment where you can rub shoulders, you can actually talk to wealth creators, to entrepreneurs who may look like you, who may come from circumstances like you, who may come from an environment like your environment. And then once you go ahead and grab that baton, you might say, well, this is possible. This individual over here did it, and now I can do it. So ICAVA is raising our level of vision, and they're doing a fantastic.
Follow the Brand TV broadcast host, Grant McGaw, as he visits with top executives and entrepreneurs to find out their secrets of success with their personal brand. Follow the Brand TV broadcast host as he focuses on brand development to build better relationships, bring value to your business, relationships, and career. You will enjoy listening to each episode that is tailored to speak to you directly. If you're looking for this type of clarity in terms of building your brand, you have tuned into the right station. Each episode will help you to shape a conversation in the 5-star BDM network of 20,000 professionals and become a springboard for your corporate engagement and business opportunities. Each guest will frame their story in the areas of personal branding, business development, career development, financial empowerment, and technology innovation. Grant McGaw explains why he is the CEO and owner of his own professional career. Grant is an accomplished business leader and entrepreneur who wants to give back to individuals to grow their personal brand strategy. Tune in as he weaves his story about new possibilities, while to you exceed expectations. If you love storytelling, this show will make for fun.
ATL runs on V Plus Energy. We love our home and our people. We at V Plus made it our mission to provide healthy energy to our city, so that's what we did, and you all love it. 5 fruits, 5 vegetables, 5 vitamins. It's healthy, tasty energy. But don't just take my word. Listen for yourself.
Man, I tried a lot of energy drinks. Tastes good. That's one of the biggest things. Refreshing, and it's not too strong. So I like it, man.
People, it's Alexander Aperture, V Commercial King, and check this out, man. We're here with V Plus Energy. Look, you try to get your energy up. You out here in a competition like this, man. Field day. You're gonna need something to get a little extra kick. Make sure you get that V Plus Energy.
Hey, what's up? It's Clay Johnson Russian, and we are checking in with the V Plus Energy drink. This drink is amazing. I love that it don't give you the jitters. Friday, check it out. The drink is very good. I like the peach flavor. And so far, I'm trying to see if the energy kicks in.
I guess that energy kicked in. Now it's time to get you some. Visit drinkvplus.com.
Welcome back. We are delighted to have with us our guest from the ATTCLC, the African fight for the finishing the fight on the use of tobacco and trying to eliminate menthol products off the marketplace, getting it banned across the states of just not 2 states, California and Massachusetts. We're here with Dr. Philip Gardner here on health, wellness, lifestyle.
Is Carol coming back?
And we hope that our other guests will plug back in. You know, this is
Yeah.
live TV, going in and out is certainly common. And, you know, I put something in our discussion as we were on commercial and want to really talk to you about that, because this is appalling, the type of tactics that are used by the tobacco lobbyists. And what have you seen out there? Welcome back, Carol.
Thank you.
Hi.
I'm back. Thank you.
Garner, can you talk a little bit about what you understand are some of the more interesting tactics that the lobbying community for the tobacco industry are deploying?
Let me just thank you for putting in the people on. We have a in studio chat going on, and what Linda put in the chat is extremely important. I'm going to read part of you. The FDA has stated importantly cannot and will not enforce against individual consumers for possession or use of menthol cigarettes or flavored little cigars. It says that 3 times in a number of places in the actual proposed rule. So all of this discussion that's going on out there about how police are going to somehow have greater interaction with African Americans, just not true. The law doesn't even say that. It says nothing about individual use, purchase, or possession. So these tactics used by the tobacco industry and then picked up by, unfortunately, some in our community to put this forward is really, really thankless. And then the second thing you put in the chat, which and we actually know Reverend Sheffield, we had been working with him for some time in Detroit. And in the midst of us working with them, he was approached directly. And he was approached by some people doing business with the tobacco industry. He was initially offered $50,000 to come out against menthol. He refused. They called him back in 2 or 3 days and says, well, what if we make it $150,000? He refused. They came back a few days later and offered him $250,000, and he still refused. So there are some people that are, hats off to him, that are above reproach. But you can imagine if you're a small business owner in a small Black community and someone offers you $250,000 to support selling menthol cigarettes, you're going to take that $250,000. This is how opportunistic the tobacco industry is and how bad it's been for our community.
Carol, I wanted to ask, where's the medical community been on this?
So the medical community has been standing firm with us. Dr. Phil mentioned that we actually sued the FDA, which prompted them to deal with the citizens petition that had been filed previously to us. But our co-plaintiffs were the AMA, which is the American Medical Association, and the NMA, which is the National Medical Association, of which you're a member, and that's our nation's Black doctors. So when something is so egregious and so bad that patients, doctors, physicians have to sue the federal government to make them do their job, then that says it all right there. And the way that the industry is using our people against us. And so one of the things when you hear people talking about this is going to be bad for the community, this is a storm brewing, they need to disclose if they're receiving money from the tobacco industry. Yes. Just as any scientist, any researcher, you disclose where'd your funding come from. And so there are 3 words that these folks will never say when they're the tobacco industry. They talk about this in nebulous terms, if these cigarettes just fall from the sky. They never mention the racist and predatory targeting. They never talk about that our community deserves reparations from the tobacco industry for all of the harm that has been caused us. So rather than fighting us to keep the tobacco, these deadly products in our community, they should be fighting the tobacco industry to make them be a part of this, that a neutral entity would control to help our community. That's the fight, and to fight for services for our people. I'm not going to fight to have crack cocaine remain in my community. Crack cocaine brings crime, I'm going to fight to get that out of my community and to fight for services for people who are addicted to those products. The same as with tobacco, which actually kills more of these other illicit drugs that are also problems in our community. But they actually, tobacco is just as bad or a bigger problem.
I remember working when I was in San Francisco during my internship. I used to go to a halfway house where people were entering back into society after drug convictions and so forth. And they always told us that the hardest addiction that they had to break was cigarette smoking, that was harder than anything else.
Not to put you, that's a very excellent point. There's actually a good, one of the things I got involved in early on is trying to figure out, and this is working with halfway houses. The majority of people who are who are recovering alcoholics, the majority of them, I think the figure was 54%, die of tobacco related diseases. So, I mean, it's a scourge. I mean, we at some point, and maybe Carol could talk about it, we have to figure out how to move people away from using these products altogether.
Yes.
It's an unnecessary death that we put upon ourselves, so some people can make money. It's what we'll be calling the end game. How do we stop selling a product? Look, if I came out today in 2023 with a product and say, here it is, and if you use it the way I suggest, it'll kill you. That wouldn't get approved. That couldn't be sold. But
Right.
since this product came out
and it does no good. I mean, there are certain things that have side effects, negative side effects that you use because they do good. There's nothing that tobacco does good.
And when you burn it, it kills you. So we have to figure a way out of this. I'm not sure what the way out, but I'm in the fight for it. So, but be aware that's where we are with this.
And who are some of the
Right.
other partners that you work with?
Well, Carol mentioned the
Tobacco-free kids.
tobacco-free kids. Clearly, Heart, Lung, and Cancer Association, the Truth organization. But we should do a special shout out to the Center for Black Health and Equity, which actually is working with us on a nationwide basis in a number of different cities. In fact, the Center for Black Health and Equity will be hosting a meeting in Washington, D.C. in early November to actually put together a unified national plan to how to tackle the question of menthol. Because what we find around the country now, people are doing this, people are saying, well, maybe we could do that, maybe we don't have to we can keep menthol in cigars and all of this. There needs to be one plan that we can do it all. I want to applaud the Center for Black Health and Equity for taking that up.
Is that the center that had the conference in Puerto Rico where?
That's correct. That where you were at, and we honored you. Yes.
Yes. And I want to say that no one loves a Black smoker more than the African American Tobacco Control Leadership Council. That is why we exist. It's for our Black smokers, and that we love them. We are supporting them. We have another project, and the website for that is amplify.love. That's the ending, amplify.love. And we are getting into the cessation space more because of the necessity, and that we are doing this for our people. We're not trying to hurt our people. We want our communities to be healthy, to be thriving, to be whole. And we know that that is possible, and that a big source of the vector for all of what ails us is tobacco, and the tobacco companies standing behind it.
And because we always want to educate our listeners and viewers, cessation meaning give up tobacco smoking altogether in all forms, correct?
That is correct. And we are, we haven't talked about vaping, but and there's a whole movement now in public health of harm reduction. And so vaping is we don't want our people to go from smoking to vaping. We want them to stop. We don't want our people to be lifelong customers for Juul and for these vaping companies that have positioned themselves to take, as laws change, they're positioning themselves to inherit the Black community as lifelong users. And so harm reduction. Donna, when you're in San Francisco, harm reduction is not about giving every person an IV syringe to say, if you want to be an IV drug user, here's a safe needle. It's about getting these products off of the market. Our children are vaping. And so, initially it was mostly white children, but now our children are vaping as well. And vaping has its own health consequences. So it's not the panacea to get people. We want the resources there to get our people to stop. And so there in England now, people are touting, well, England is encouraging people to vape. England is switching over. England is sending out plain wrap vapes. They're not sexy. They're not bubble gum. They're not involving naked women to advertise them. So that's not the way that we want this movement to go. We want cessation. We want people to stop. And our people can stop the way other people have. We just need a little more help. We need more resources. And that's what some of these folks who are trying to keep the deadly products in our community, they need to put their energy into resources to help people to stop and to want to stop. And part of that is education, the education that we're doing today.
And it sounds like California is so far ahead and has a blueprint for other states to really follow. I mean, I've read it on your website about finishing the fight. And I'm wondering if there's a way that we can bring the success of that campaign, that initiative, to where it is now, and then be able to introduce it into our own communities. Work with advocacy-based organizations that are doing great work across the country, but have yet to pick this subject up as something to fight for.
Yes. Yeah, go on, Phil.
Well, I realize I just want to make
And
sure
your
this.
answer, do attorney generals get involved in this, the state attorney generals? Go ahead, Phil. I just wanted to add that.
I realize I'm going to bring up a not too good subject here, but I don't want us to get away from it. As we move to get rid of menthol, and we've been successful in a couple of states, and we've been successful in a number of locales, the tobacco industry has reintroduced what they're calling non-menthol cools and non-menthol Newports, or what we jokingly call non-menthol menthols. They have a different ingredient in it than menthol, but has the same effect on allowing deeper inhalation and all of those things that I talked about. And they have introduced this in mass in California. Once the bill passed in December of last year, the market in California is flooded with these new products. They're doing it in Massachusetts. And if the FDA does what it's supposed to do this year and outlaws the production and sale of menthol, the tobacco industry is coming in with these new non-menthol products, and they're flooding the market. The fight is a long way from over. I don't mean to be a Debbie Downer, but we can't lose sight of this. We mustn't. In fact, we do a whole webinar on it. We can talk more about it later. I'm sorry. I just wanted to make sure that
that's so important, because who would know that if you didn't tell us? Who would understand that they're swapping out very slowly and methodically one product that will look as if there's been an accomplishment in fighting, but yet we have the same community buying into and moving forward with a product that is just as deadly, just as impactful. And certainly economically, we're not manufacturing it ourselves in our own community. So our dollars are going out to buy our poison. So this is what I'm saying. How can organizations link up with you that are doing important advocacy work, particularly those in the health and wellness space, part of their agenda, their economic empowerment space? Where are the sororities and fraternities and the Black serving organizations on this matter? How do we get that information out there? I belong to a bunch of them. And
so the first thing is for people to go to our website, which is savingblacklives.org, savingblacklives.org, and to sign up for our emails and our listservs. And there's an email there where you can email us. So far, the Divine Nine, our Black fraternities and sororities, are getting more and more on board. So Delta Theta Sorority Incorporated, they're our anchor, our foundation in this fight in terms of the sororities and fraternities, and that they've done 2 resolutions. And once they did their first resolution, when Delta speak, people listen. So that opens the space up, and we're actively working with our D9 organizations, the Alphas, all of them, but the Alphas, our brothers have passed some resolutions. They have their own health surgeon general within their fraternity. And so we're working more and more. As part of our conference that we had in Puerto Rico, we had a D9 summit, a D9 workshop of getting our groups on board. And I have such faith that once they really understand and really take this on, because if you're in a fraternity or sorority, you belong to multiple organizations. That goes without being said. And so reaching articles for good into our own organizations and having them to really take this fight on and know that it's a fight, as Phil said, that, to be in it for the long haul, which we are in it for the long haul.
I appreciate that. I'm a member of Delta Sigma Theta Sorority Incorporated, and also, absolutely,
that was good.
Yeah, I'm going to take this back to the National Coalition of 100 Black Women, because I'm a member of that organization, which is a full public policy advocacy-based organization.
Yes.
Everything I've heard now is so new to me, and you would think that it wouldn't be given my family history. But now being able to combine family tragedy and history with information, hopefully those who are like myself will really take up a voice and join this effort for sure. And I've just signed up.
And National 100 Black Men, they have a national resolution supporting this as well now. So it's snowballing, and it's just increasing, and it's a wonderful feeling for us who've been out here on our own for so long, and to have our own organization to really understand the impact and the importance of digging into this fight and getting in and staying in for the long haul.
And I just want to,
Linda,
Donna, 1 second. I just want to say something that for those organizations that don't know where to start or how to advocate, you have an amazing toolkit on your website that gives them the tools and the resources and the information on how to develop those and how to even come before and give testimony. So I appreciate those toolkits that you've put together that takes us to the place of just actualizing and implementing them, not creating. So we have a unified group in that. Donna,
and we are available to help with that. We're available for presentations, for keynotes, for on media like this. So we are available, and with technology, you can zoom in from all over the world and put on a TV show like this. So that's very important.
Outstanding.
Right. We had an event in DC last weekend, and is Aisha Braveboy your Attorney General?
She is.
Yes, she spoke. So and she was so she had so many insights, and she was so forceful. And I was just wondering, are attorney generals getting involved in this fight? Because I'm sure she would take it on.
They are. So attorney generals, I don't know how many attorney generals have signed multiple letters supporting the FDA to take these products off the market, to get the rules out. So the attorney generals broadly are very supportive of this, and they, because I think also the lawsuits with Juul, they've all been re-educated about how these products can get out and proliferate in our country, and so they are on board.
Are we seeing the HBCU community, a community that we don't necessarily associate with advocating for these kinds of opportunities to enhance and support and actually survive the Black community? But how are we working with like the Thurgood Marshall Center Scholarship, Center Trust, the Thurgood Marshall Scholarship Fund, the United Negro College Fund?
Be aware, and unfortunately, those two organizations that you mentioned, the tobacco industry is given literally tens of thousands of dollars.
Millions, probably.
Yeah, you're right. It is millions. I didn't want to, since I didn't have the facts right in front of me. They've been doing that with HBCUs since day one. They give it to our cultural organizations, our political organizations, our educational organizations. In fact, I had a chance to speak at Meharry this back in 2019 or 2020. Juul had given $7.7 million to Meharry to talk about, well, what can we do? What can we learn about tobacco, and what's good, bad, and ugly about it? let's be aware, and we haven't had a chance on this call to talk about it. We need to set up another one. And Carol already mentioned it. Vaping is not good for you. There is no, they say, oh, it's just water vapor. There is no water in the electronic cigarette juices. I would like to go into that in much more detail. I would take us a little bit off where we're going now.
And the hoocah on our HBCUs as well. That's another show, another
that's a
story.
whole
Yes.
other, yes.
Well, let's make sure we do that right away.
Bars.
Say that again, Donna.
The people who are not smokers necessarily, they'll go to a hookah?
A hookah.
Hookah bar. Hookah.
Like, yeah, as
Mm-hmm.
a means of entertainment. And these are not necessarily smokers, but they're still
The secondhand
it's still
smoke.
secondhand smoke. Right.
And
A hookah session is like a pack of cigarettes.
A hookah session is even worse than a pack of cigarettes, and it's the whole idea that this is somehow culturally appropriate because it comes from the Middle East is, and I can't say that on television. It's just not true. What I would see from our discussion today, we need a discussion about electronic cigarettes. We need a discussion about hookah. And we need to go into the depth that we've done here with menthol. I mean, the active ingredient in the electronic cigarettes are what we call propylene glycol, and it's what we call a humectant. It actually adds what we call freshness and feeling to a certain subject. So when Dracula comes out on stage and all that, there's that vapor around him. That's propylene glycol. Okay. What else is in the e-cigarette are flavorings, and like the menthol. What else is in there is like nicotine. So there's not even any water in there. So this whole idea that it's water vapor is
So in other words,
something.
in other words, there's nothing in any of these products that promotes health and wellness.
Thank you.
A lifestyle. That's our name of our program, Health, Wellness, and Lifestyle. What we're saying is that Black lives, save Black lives. Focus first on this menthol, and then we're going to go through in the continual advocacy to eradicate these particular products from the shelves because they're not serving our community. They're contributing to the ongoing death and destruction of our community. And we need more voices in the fight. And I'm glad to hear that serving organizations, we will have to really have a conversation with our HBCU community and the overseers of that community from a scholarship base. We know money is important, scholarship's important, but why bother to have an education if you're going to be dead, right?
We need to find alternative ways of funding these groups, because that's where the problem lies. It was hard for CBC to raise money. It was hard for the foundation to raise money. It's hard for the college and university organizations to raise money. We need to really work hard at finding alternatives.
But I worked for United Negro College Fund back in the day, and the Honorable Bill Gray, who was my president at that time.
Oh my goodness, yes.
I thought I was going to raise money from the gun lobby, and he told me there's good money and there's bad money. We're not going to take that money. And that's the kind of leadership voice that we have to be very firm and say. Tell us the website one more time as we're coming down to about a minute.
It is very easy to remember, savingblacklives.org. Savingblacklives.org.
Let me say something.
Black Lives Matter. We were saving Black lives.
Yeah. I was going to say before, but it's always mattered. We just happened to, when we came together, that's what we were about. And that's what we're about now, is saving Black lives. I know it's become popular around the country, but let's make it popular around our health.
I love it.
Yeah. We're saving a lot of lives.
You back on the program
and by
continue
getting rid
on.
of menthol.
Yes, we're going to do that. I thank you so very much.
Thank you.
This has been the Health
Thanks for coming on.
Lifestyle with Dr. Donna.
Good seeing you again.
Good seeing each and every one of you. Until the next time, till part 2. Have a great afternoon, everyone.